Hello friends, today we will discuss about toxicology and I have included all the important topics which were asked in the previous 5 years and also included the PYQs which are asked in the UPSC, NEET, FMG and INISET. So we will discuss all the topics one by one. Firstly, we will start with the snakes, scorpion, then spider. Then we will discuss the plant toxin, deliriant, which are the deliriant and the cardiac toxins. Then metallic toxins, such as the arsenic, lead, mercury, etc. And then acid versus alkalis. We will discuss about different acids such as the carbolic acids, oxalic acid, H2SO4, etc. And then we will talk about the alcohol, the ethanol and the methanol. Then we will discuss about the type of the drug smuggling such as the body packer or the body stuffer syndrome, and we will discuss some of the miscellaneous topics such as the smell in poisoning cases, postmortem staining in the poisoning, etc. So firstly we will discuss with the snakes. So in every topic, firstly we will see the image, then we will discuss the theory. So let's start. The first image that we can see is this is the image of the cobra, or also we call it is a naza, and in the local language we also call it the nag. So from naza or the nag, we have to remember that it is a neurotoxic, and it is very easy to identify the cobra. There is a hood in the cobra. Now the second image is of this. Here we can see a snake in which the bands are present. Various bands are present in a linear form, so we can say that it is a banded crate. Banded crate. The third image that we can see is the various saw scales are there. So this is the image of the saw scaled viper. Now here we can see many different type of snakes, and these all are the myotoxic, which are the sea snakes. So these all are the sea snakes, and this is the cobra, king cobra, and this is the banded crate, and this is the viper. So these are the important four snake that we have to remember and that are asked in the exams. So if we talk about the parts of the snake, then it has the mouth, it has the belly part, and it has the tail part. Also some scales are present on the back side, and eye is present, then head is there. So here we can see all the things such as the tail, head, eyes, scales are present on the back, and this is the belly part. So now we will talk about the theory of all these snakes. So snakes can be divided into the LEPD, VPD, and Hydropd, which are important for us for our exams. So in the LEPD, cobra and crate are there. In the Viperid, vipers are there, and in the Hydropd, sea snakes are there. So firstly, we will talk about the cobra. Cobra is also called as the naza or the nag, and it is a neurotoxic snake. The poison in the cobra is the neurotoxic. Similarly, in the crate, which is also called as the banded crate, the toxin is the neurotoxic. The fatal dose for the cobra is 12 mg, and fatal dose for the crate is 6 mg. The death, which the most common cause of the death in the case of the cobra and both in the crate, is respiratory failure, because neurotoxic will lead to the damage to the nerves, and finally the muscle will not work, and finally it will lead to the respiratory failure. So firstly the other muscles involved, so it is a type of descending paralysis, but finally when the respiratory muscles are involved, the person is not able to respire properly, so he will die due to respiratory failure. And overall, if we talk about in any case of the uh, snake bite, then the most common cause of the death is shock, because mostly the death occur due to the shock. That person become uh, very anxious after the bite of the snake, so it is the most common cause of death. Now in the cobra and the cray's, the all the features are almost similar. So the clinical feature in both of them is pain occur at the bite site, then swelling will occur, and respiratory failure will occur, which will lead to the death. It is a final symptom. And the first symptom or the earliest symptom due to the neurotoxin and the damage to the muscle is the ptosis. So in both of them, the ptosis is the first or the earliest symptom, and last symptom is the last will it will lead to the respiratory failure. So what we have to do when there is a case of the snake bite? So there are some basic things that we have to do, and there are some specific things that we have to do. In the basic thing, we have to firstly reassure, follow the right. We have to reassure the person. Then we have to immobilize the part in which the bite is there. Then we have to go to the hospital and tell the doctor about everything, the type of the snake, the bite site, and all the symptoms that you have seen. And then the final is the treatment. And firstly, we can also wash the site with the water, but we should not use the soap. And this is common for all the cases of the snake bite. And the thing that we don't have to do is that we don't have to do sucking that is shown in the movies, and we don't have to debride the part. We don't have to apply the tourniquet. We don't have to kill the snake. We don't have to use the soap. So the treatment for cobra and the crate is anti-snake venom. Anti-snake venom, and anti-snake venom can also use in uh, all the snake that we are studying, but it is not used for the scale viper. Hummed scale viper bite cannot be treated with the ASV. So we can give ASV. In the cases of the cobra, we can also give atropine plus neostigmine, and these are for the symptomatic relief to decrease the symptoms. But in the case of the crate, we use only neostigmine. We don't have to use the atropine. So atropine and neostigmine are used in cobra, and in the crate only neostigmine is used. And also we can use the ventilatory support. Ventilatory support is important because we know that the respiratory failures occur in both the cases, cobra and the crate. Now we will talk about the vipers. Vipers are vasculotoxic or hematotoxic. It means that they will damage the blood cells or the blood, and it will lead to the hemolysis. So the most common the cause of death in the viper bite is hemolysis, but most common cause is again the shock. Vipers can be Russell viper or the soy scale viper. So we here we have seen the this is the soy scale viper, and the another big, it is a Russell viper. So Russell viper and the Sosnil viper both are vascular toxic, and the cause of death is hemolysis. And in vipers, in the viper bite also, we have to follow the right. Then the final treatment is anti-snake venom and the fresh frozen plasma. Fresh frozen plasma, because in this the hemolysis occurs, so we have to give the fresh frozen plasma. And the clinical feature in the viper bite is because it is a hemolytic, it has a hemolytic toxin, so it will lead to bleeding, hemolysis, swelling, blisters, and the complication can be DIC, coagulopathy, internal bleeding, and the shock. Now the third one is the hydropedy or the sea snakes, and these are the musculotoxic, so they will damage the muscles. And as the muscles are damaged, so the cause of death is all in this also is the respiratory failure. But the most common cause is again the shock. So in the musculotoxic, we have to follow the right. similar, and in the clinical feature, respiratory arrest occur and the muscle necrosis occur due to which the myoglobinuria occur. So myoglobin is present in the urea, and it represents that the muscle necrosis is occur, and in this also we have to give the anti-snake venom. In the vipers, we have to do the 20 minutes clotting test to check whether there is any improvement after giving anti-snake venom or not. Now, this is the image of the scorpion, and this is the image of the spiders. And they both can lead to the severe type of poisoning. So, firstly, we will talk about the scorpions. Then, the clinical feature of the scorpion bite is salivation, sweating, myocarditis, dilated pupil, autonomic storm, and it is a very important. Autonomic storm can occur. So, for the treatment of the scorpion bite, we give the anti scorpion venom, and also we will give the prazosin for the symptomatic relief. So, it is previously heard about the prazosin that we have to give in the scorpion bite. In the spider bite, we can see that the symptoms are swelling, redness, warmth around the bite, itching, muscle pain, difficulty in the breathing, vomiting, chills and fevers, and headache. In the treatment of the spider bite, we have to give the NSAID for decreasing the pain. We have to apply the ice for decreasing the swelling, and we have to give the antihistaminics. Now the second topic for today is plant toxin. So firstly, in the plant toxin, we will talk about the deliriants. So firstly, we will see the image of all of them, then we will talk about them. So this image, first image is of the, here we can see a capsule like structure, and this is the capsule of the poppy plant. Poppy or Papaver somniferum. So in this the unripe capsule, here we can see it is an unripe capsule, and when we make a cuts in the unripe capsule, we have to make the longitudinal cuts. Then the milk-like product will come out, and this milk-like product, when dried, is collected, and it is used for making the opioids such as morphine, codeine, etc. So this is the image of the Papaver somniferum of the poppy plant, and this second image is of the Erythroxylum coca. Here we can see a small reddish fruit-like structure, and it is the image of the Erythroxylum coca. So in the Erythroxylum coca, it is used for making a various. It is also used for making the crack, coke, and it is also called as the white lady, snow, etc. So it, from here we can derive the cocaine, we can make the cocaine. Now the third image is of the, this is the image of the, and this is also both all the three images of the datura. So we know that the datura can be of alba, nigra, and the thorn apple or the stramonium type. So this is the image of the datura alba, this is the image of datura nigra, and this is the thorn apple. So in the thorn apple, that we can see a fruit-like structure or the round structure in which the many pickles are there. So as we have seen that it is used for puja in Shiv Mandir. So these three images are of datura. Now this is the image of calotropis. In calotropis, it is important because we have to know all the parts, because all the parts are used for making one of the other thing. Such as if we talk about the leaves, then we can make the bhang from it, If we talk about flowers, then we can make a ganja from it. If we talk about the stem, then we can make a charas or the hashish from it. And any part of the calotropis plant can be used for making the marijuana. So again, we will see all of them. This is the poppy plant. This is the erythroxylum coca. So erythro means red. So this is red. And here we can see Datura alba, Datura nigra, and thorn apple. And this is the image of the calotropis, in which we can see the leaves, stem, and all other parts can be used for making the marijuana. So now we will talk about the plant toxin that we have seen the image above. So we can remember by the OCDC. OCDC means opiates, cocaine, datura, and cannabis. So in the opiate, we have to remember that oh, that it is derived from the poppy plant or the Papaver somniferum and from the unripe capsule, and it is used for making the morphine or the afim or the codeine, etc. And the clinical feature in the opiate poisoning is there is a decrease in BP, decrease in heart rate, decrease in pulse, and decrease in pupil size. So pinpoint pupil occur. So it is important to remember that all the things will decrease in the opiates. In the cocaine, also called as the crack, coke, white lady, or the snow, which is derived from the erythroxylum coca, in this all the things will increase, such as increase in BP, increase in heart rate, increase in pulse rate, increase in temperature, increase in lacrimation, agitation, and also increase in the incoordination. So everything will increase. In Dhatura, also called as the thorn apple, the main active principle is the hyoscine, and second is the atropine. So we have to remember 9 Ds over here. In the Datura, we have to remember 9 Ds. 9 Ds represent for dry skin, dry mouth, dysphagia, dilated pupil, which is very important, and delirium, dysarthria, diplopia, and drunken gait, and the death. And there is no diarrhea, we have to remember. So it is as in the previous year that which of the following feature is not the Datura. All the option are the D ones, but diarrhea is given, so it is not seen in the Datura. Instead, constipation is seen in Datura. Now we talk about the cannabis. The active principle is tetrahydrocannabinoid, and from the leaves. Sorry, I mentioned it as a calotropis. It is a cannabis. Sorry. So from the leaves of the cannabis, we can make a bhang. We can from the flower we can make ganja. From stem we can make charas or the hashish, and from any part we can make marijuana. So uh, in bhang we have to remember, or in overall cannabis we have to remember that it has a burnt rope smell, which is as in the previous years. PYQ, and it is a PYQ, so it has a burnt rope smell. If we talk about the ganja, then it is associated with the run amok. So run amok is a type of the crime in which the person kills someone and then do suicide. So पहले उसने किसी को मारा, फिर भाग गया और फिर उसने खुद भी सुसाइड कर ली. So or it is also associated with the amotivation syndrome. Now we will talk about the other things of them. In the opiate, as we have seen that the poppy capsule is there, which is the unripe capsule. We have to make the longitudinal incisions in them, and when the milk oozes out and it dries, then we will collect it for making the morphine, afim, etc. So opiates are the morphine and codeine, and opioids are the heroin. So treatment of the opium poisoning is the naloxone. Naloxone is given the parenterally. So if we talk about oral, then naltrexone should be given. So for the parental, naloxone, which is the antidote for the opioid poisoning, and oral naltrexone is given. And gastric lavage is done with the 1:500 kmno4 in all the cases of the opiates. If we talk about the cocaine, then in the cocaine, we can see a cocaine bugs or the Magnan syndrome or the formication, and it is a type of tactile hallucination in which the person feels that some bugs are crawling on the skin or the below the clothes. So it is seen in the case of the chronic cocaine poisoning, not in the case of the acute cocaine poisoning. So when the person is taking the cocaine for very long, then the cocaine bugs can occur. So the clinical feature in the cocaine poisoning is the black teeth. The teeth will turn into the black, and mostly the route that is used for the cocaine poisoning is the smoking and the snorting. If we talk about the fatal dose, then it is a 1 to 2 grams, and treatment or the antidote for the cocaine poisoning is the amyl nitrate. Now we talk about the datura. Datura is the most common road of the railway poison, as we have seen that while we are traveling, some of the persons such as the babas, etc., will give you something to eat, and then you will become unconscious, and they will take away your luggage, etc., or they will loot you. So it is used for the road of the railway poisoning. Most commonly used the road of the railway poison. And if we talk about, as we have seen that there are three types of the datura alba, datura nigra, and the strontium, which are also called as the thorn apple, जो अपन शिव जी को चढ़ाते हैं. And treatment for datura is the physostigmine, and because it can cross the blood-brain barrier. So we don't have to use the neostigmine because it do not cross the blood-brain barrier. So we have to use the physostigmine because some of the CNS symptoms are also there. We have to decrease, such as the delirium, etc. In cannabis, we have to remember that it is a CNS stimulant. So now these next images are of the other poison plant toxin, which are the cardiac poison, or which are the cardiac toxins. So in the cardiac toxin, we will talk about the digitalis purpura, oleander, nicotina tobacum, aconite, and the cerebra thrivia, which is also called as the yellow oleander. So we will see the image one by one, and we will talk about them. So this is the image of the digitalis purpura. So pinkish flower are there, which are present in the form of the rod. So we have to remember that it is a picture of the digitalis purpura, and it is a cardiac toxin. As we know that digitalis toxicity is related to the cardiac problem, and the treatment for it is a digibind. We will give digibind, so it will bind with the digoxin, and it will decrease the toxicity. The second image is of the oleander, and it is a red oleander. So it is a normal flower. So the leaves are like this, and the flowers are very normal, like other flowers. And similarly, we can see in the yellow oleander also the leaves are similar to the red oleander, but flowers, yellow color flowers are there, and so we can remember, we can identify that it is a case of the yellow oleander, and if it is red are given, then it is a red oleander, and both are the cardiac toxin. If we talk about nicotina tobacco, in the nicotina tobacco, we know that the in the tobacco or the tobacco leaves are very important. So we have to see these leaves, and it is little thick leaves, and the large leaves are there, and the flowers are nearly bell-shaped, red color flowers. If we talk about the aconite, aconite is also called as the blue rocket, or the mita zahar, or the wolf's bane, or the monk's hood. So in the aconite, we have to remember a rod-like structure is there in which the many purple flowers are there. So rod-like structure with many purple flowers, and rod-like structure with pinkish flower is for the digitalis purpura, and rod-like structure with the purple flowers is for the aconite. And it is a cardiac toxin, so it will cause the AV block. And first symptom is the tingling around the mouth. So there is a tingling around the mouth in the case of the aconite poisoning, and it is used as an ideal homicide agent, and it is also called as the metal hair. So it is a homicidal agent because the taste of the aconite is a little sweet. and it will lead to the hypotension, or the decrease in BP is there, and it will lead to the HIPAS, which is the person who has the aconite poisoning will present with the meiosis and the mydriasis, which will occur alternatively. So firstly the meiosis occur, then mydriasis occur, then again meiosis occur, like this. So these are all the plant toxin which are the cardiac toxin, and we can remember by the DONAC: Digitalis purpura, oleander, nicotina, tobacum, aconite, and cerebra thevia. Or we have to remember the main yellow oleander, because it is more commonly as a name of the yellow oleander.